I will call the meeting to order and remind everyone to please disclose of any pecuniary interests at the appropriate time. And we'll go right to our Medical Officer of Health update. Dr. Renaday, I'm going to turn the meeting over to you. I see that he's on the line. There he is.
Can you hear me?
Good morning.
Good morning. How's that? Can you hear me?
A little louder.
Up a little bit.
Okay. How about now?
That's better.
Okay, great. Okay, good morning. So if you give me 1 second, I'll just share my screen here. Okay, can you see that? Okay, perfect. Great. Thank you, Councillor. Thank you. Good morning, everyone. I'm happy to give you an update on what's going on with COVID-19 in our community. I will touch briefly on the local status and then walk through some updates regarding screening, diagnosis, surveillance, what's going on in the healthcare system, as well as any updates on related to prevention. So our cases to date have been 230. We've had 167 recoveries. There have been 19 deaths, and our positive test rate is currently sitting at 4%. That varies with the number of tests that you do. Certainly in the early days, we found that that number was much higher. The tests were being done mostly on symptomatic people, and so we were getting a high positivity rate. But as you test more and more folks, your positivity rate goes down because you don't really expect many of them to have disease. That's just a little snapshot, but of course we've got more information on the Lambton Public Health webpage. If you click under the dashboard on detailed report, then you can get the cumulative counts. So the current cumulative graph looks a little bit like this. I hope you can still see that. That's just a snapshot or a cutout from our webpage. And you can see that, I'm not sure if you can see my mouse moving here, but you can see that there's been a flattening of the curve and a little spike and again a little more flattening. I think, remember that this curve will never go down to zero because it's the cumulative total, so it's a running count. So what you expect from this curve is for it to be flat and for it to stay flat, but it'll never go back to zero because these are the number of cases that we've had to date and they will always stay there. An update on the congregate setting screening. So there was a directive from the province around screening certain congregate care settings. It started off with long-term care homes and retirement homes, and I'm happy to report to you that 100% of those are completed in the sense that staff and residents at all of the facilities have been offered the option of a screen or a screening test. And upcoming settings that'll happen this week and into next week are the essential services daycare, shelters, and group homes. But it's important for me, I think, to share some preliminary results of that, of the testing that was done with you. And so for your information, we have screened 1,370 long-term care and retirement home residents. And out of that, we were able to identify 5 cases. And we screened 1,424 long-term care and retirement home staff. And through that, we were able to identify 1 case. And so when you look at those numbers, I think it's very important to take stock of the amount of testing and the level of effort that goes into that testing that is required to find 1 case of disease. And I think it goes back to the point that I made about the value of testing in asymptomatic people. It's much, much more useful when you use that test to detect disease in people who have symptoms. And these kind of numbers are essentially what we would expect from the process of mass testing of asymptomatic people, that you really won't find that much disease with this current test. I think it's also important to remember we will carry on with the directive to test in those other congregate settings, as I would not expect those numbers to be much different. Certainly, we're not going to screen as many people because there aren't as many people. These are high volumes, but it's important that you have a sense then of how the volume of testing relates to the actual identification of cases. Just to update you on the other 4 areas, so in terms of diagnosis, so Health Canada has approved a serology test. It's important to know that that is not a point of care serology test. So it's not like something you could just get done in an office and then you'll have a result in a few minutes, or something that we could bring into the field in the community. It's a lab-based test, and so labs will have to decide how and if and when to incorporate this test, and under what circumstances will they consider running those tests. They'll take a bit of time to validate and incorporate into use, but the primary message about those tests is that I think they have two main purposes. The first is a better assessment of when someone has recovered from disease, because that's it measures the antibody response to the disease itself. And so that will help in the sense that we have a lot of folks who are using testing as a way to clear people, to say, well, you're now over the disease after you've been diagnosed. But it's not a very effective test for that purpose, because you can still have bits of the virus sitting in your cells without necessarily us thinking that you're infectious. And so that results in a number of people who continually test positive well after their symptoms have resolved. And the serology test would help us better identify those people who are recovered. The other reason for a serology test is that, you can do what's called seroprevalence studies, which means that this is the kind of test that you can sort of randomly do in the population to see what the baseline prevalence of exposure to the disease is. It'll be much more useful for that purpose. Still time intensive, but the results are easier to interpret in the context of when you get a positive or negative from someone who didn't have any symptoms. A surveillance update, just to let you know, Lambton Public Health will be launching a population-based COVID-19 survey later this week. We do population-based surveys routinely. It does a random sample of the population to ask them questions related to a particular health issue. We felt that COVID-19 was a reasonable health issue to prioritize at this time, and so we'll be asking people in the communities questions about their knowledge and attitudes and values related to COVID-19 and interventions around it. In terms of a healthcare update, you should know that acute care services such as the hospital are preparing to ramp up services and expand beyond emergent or emergency services and into other kinds of services. And we know that there's been a backlog, and they're preparing to start to address that. There's a directive right now in place that still prevents them from doing so, but it's anticipated that as we move forward, that directive will be lifted. And so planning is going on for them to be able to take on these cases when that directive is lifted. And then finally, in terms of a prevention update, you should know that a vaccine trial has been approved by Health Canada. It's the first of what I would call many steps towards the development of a vaccine. This would be a step that determines the basic safety of the vaccine. When we inject it, is it safe? What are the consequences of the injection of that vaccine? Then you move on to other things about, is it effective? How effective is it? What are the potential side effects and that kind of thing? Although you can get some side effect data from the safety profile testing. So it's encouraging, but remember that that's still a ways down the road because there are a number of steps that have to be completed in order to make sure that the vaccine is viable and safe and effective, and then steps to produce it, and then steps to distribute it. So it's a long process, but it's an encouraging sign. So I will leave my update there and turn it back over to you, to the chair. Thank you.
Thank you so much for that update. Does anybody have any questions for Dr. Renaday? Seeing none, then I think we'll let you get back to your day. We really appreciate that. Warden Weber, do you have a comment? You're on mute.
I think Dave Bushy wants to speak to this.
Dave Bushy was asking for it. You have to unmute.
Sorry.
David.
Dave, you're on mute.
You have to unmute your mic.
Thanks for... Just press the space bar to temporarily unmute it.
Unless it's an iPad.
Oh, that's true.
There you go.
There you are.
I have a question. Can you hear me?
Yep.
Yes, we can hear you now, Councillor Bushy. Go ahead.
Okay, I want to ask the doctor in regard to sunny Lambton County, where are we comparing to other municipalities in Ontario? Are we number 1, 2, 3, 4? How does that work?
Okay, I think that you might mean in terms of our sort of rate of cases. Is that what you mean, Councillor?
Okay.
Okay, so if that's the question, we actually have the highest rate in Ontario per capita when you consider the rate per 100,000 people. It's important to remember that that is not an age-adjusted rate. That is just a pure rate, so it counts everyone in the population. It's unclear what the reason for that is, although if you rank any group, there's always going to be someone at the top and someone at the bottom. Potentially part of the reason for that is that we've had 2 significant outbreaks among an elderly population, and so we know that they're more severe and also more likely to be tested. The other possibility is that we've been doing more testing and picking up more cases, but I don't think that that's true. There are lots of other jurisdictions that are doing, high numbers of tests. So it's unclear at this time what that is or how that's going to play out over the rest of this outbreak.
Thank you.
Any other questions? I don't see anybody else trying to get through, so I think we'll let you go, Dr. Renade. Thank you very much for that update.
Great, thank you.
We'll see you on Friday morning.
Okay.
Thank you.
All right, so now that we've gotten past that, we will go into our regular agenda. We're going to start with number 4, long-term care division. There's some correspondence to receive and file. Do we have a motion to move by Warden Weber, seconded by Bev Hand, to receive and file? Any questions or comments about that correspondence? Seeing none, we'll move on to the information. Oh, all in favor to receive and file? That's carried. And we'll move on to the information report A. Is there a, do we need a motion to receive and file this? Yes. Moved by Doug Cook and seconded by Deputy Warden Kevin Marriott. And I'm going to pass it over to Jane Joris to kind of highlight anything she would like to highlight in that report.
Thank you, Councillor Rombouts. The only thing I would like to update is that it does appear that there's an increase in outbreaks. At the moment, I think it's 184 long-term care homes in the province. And as all of you know, we do have an outbreak at Marshall Golden Manor. That was 1 resident. Thus far, we've had no more positive tests at the home.
Thank you. That's good to know. Any questions for Ms. Joris? I was wondering about the pandemic pay. Have you gotten any more updates on how that's going to flow through to the long-term care homes, the retirement homes?
Mm-hmm. So we did receive some information late last week, and it had some more details. So it looks like everybody who's working in long-term care on site will be paid the pandemic pay. It's not been flowed to the county yet, but we are, and we're still figuring out the lump sum portion. So the $4 an hour we're clear on. The lump sum portion, we got a little bit more information late last week.
Okay, thank you. Councillor Stark.
Yes, Ms. Joris, is that revenue neutral as far as that whole program? It's not coming out of the county's coffers, as I understand. Is that correct?
That's correct. We understand that it will all be flowed to the county through each employer to the employees in long-term care.
Thank you.
Okay. Councillor Hand. You're muted. Bev, you're muted.
Nope,
And
still
again.
muted. Right.
There you
I
go.
hit the button.
You're good.
You're good.
Sorry. I refreshed my memory because I thought I read that the $4 an hour was being halted, and then there was the move to this long-term pay option, or sorry, lump sum option. Is that factual? Or
No,
is it $4 still
It's
flowing?
both. So it's $4 an hour for worked hours, as well as the lump sum portion is if people worked, I think it's 100 hours in a month, they would receive the lump sum, which I
Okay.
believe is $250, but I'm not positive about that.
Okay, thanks. I just thought one was, the $4 was ending at some point.
Well, it is for 16 weeks at the moment.
Oh, okay, that's what it is then. Thank you.
Beginning on April 24th.
Okay, thank you.
I know we do have some independent private retirement homes that are still waiting to find out more details on that. So hopefully they'll be told sooner rather than later. Any other questions? Seeing none, all in favor of receiving that report? That's carried. Thanks, Jane. So we will move on to, there's no other business as far as I can tell. Oh, Warden Weber?
I just want to extend a thanks to Jane and all her staff. Our homes are in very good shape, and kudos needs to go to all the staff that work at long-term care in Lambton County. So thanks, Jane. I know it's a struggle some days, and I know there's tense and wondering what's going to happen, but you're doing a great job, and keep it up. Thank you.
Thank you. I'll pass that on.
Please do.
Thanks,
Yes.
Jane.
Thank you for that, Warden Weber.
Yeah.
We'll move on to the Corporate Services Division. We've got an information report there, so we need a motion to put that on the floor or to receive and file that. Moved by Councillor Arnold, seconded by Councillor Hand. And any questions about that report? Councillor Stark.
On page 13, the addition of Part 3 prosecutions, it identifies expected increases in costs. Are there similarly expected increases in revenues?
Very good question. The short answer to that is no. Effectively, this is a downloading of the processes and responsibilities for those additional Part 3 matters that are processed through this court, but the revenue stream will not change in any way. There might be somewhat a little bit of savings in terms of the dollars that we currently pay the Crown Attorney's Office here for some of these prosecutions. But the general bucket revenues from that POA court won't change.
Is there a way to challenge the increased costs relative to decreasing revenue? Can we challenge somehow the fact that this downloading is happening, and not specifically only here, but across the board? The whole cost of downloading.
Correct. So there's a lot of work going on now in terms of the negotiation and amendments to the Memorandum of Understanding between municipalities and the province over this matter. And there's still some ongoing discussions in that regard. Luckily, here in Lambton County, I don't believe that we will be significantly financially affected, because the goal now is to try and incorporate this stuff within our current portfolios without incurring additional costs. But that can't be said for many other municipalities, including larger municipalities like Toronto and surrounding communities, where they have to really pick up upwards to 12, 15 additional prosecutors for those areas. So because of that, a lot of those municipalities are, we're all meeting together, and a lot of them are certainly discussing potential improvements and better cost sharing for some of the administrative costs that are coming down on account of this downloading. So stay tuned. At the end of the day, the purpose of the report was just to say that we're still on this. There's still negotiations. It's taken a lot more time. Negotiations were actually starting back in January, early February, but came to a screech halt on account of COVID-19. But I suspect that by September, we'll be right back at it.
And finally, is there any economies of scale to be realized by utilizing AMO in terms of making group representation?
Yeah, good point. AMO's been already at the table on this, same with other provincial associations, including the Provincial Prosecutors Association. So there has been a pan-Ontario review of this. To date, the government has been fairly receptive to some of the comments that have been received. I think now it's just a matter of defining the nuts and bolts to transfer many of these files over to the local prosecutor and what will be done. And again, we don't know this behind the scenes to see if additional administrative dollars that are collected through the system will come to the municipality versus the province. So for instance, victim surcharges do go directly to the province. There are other surcharges behind the scenes that do go to the province, and there's discussions to see if those can be streamed back to municipalities, given municipalities will be shouldering a much bigger piece of the load.
Thank you.
Okay.
You're welcome.
Did you have a question, Warden Weaver? Okay. Any other questions on that? Seeing none, we'll all in favor of receiving and filing that report. That's carried. Is there any other business for Corporate Services Division? Seeing none, we'll move on to the Finance, Facilities, and Court Services Division. There's correspondence here to receive and file. Can I get a motion for that? Moved by Councillor Cook, seconded by Councillor Stark. I'm wondering if it would be appropriate to perhaps send a letter from the warden thanking them for their commitment to safety and education. And Councillor Hand, you have a comment? Oh, you're muted.
Sorry, I had a question. Had they received any funding to this date from the county? No. Okay.
No. That's a good question, though.
Yeah, I just wasn't sure if any dollars had flowed. So it is really unfortunate. I feel, you know, they put a lot of long time and a lot of work into it, and it's.
I believe, if I could, I believe the
Yes,
county funding was conditional on getting other support, so I don't think we've had any funding at that so far. And yes, I could. We could have a letter drafted and just a thank you for their efforts.
We always like it when people in the start some kind of an initiative. Councillor Arnold.
Thanks, Madam Chair. Just the motion that was made at the county, it was conditional on them getting a building permit before we flowed any money. That's the same thing that we did in St. Clair Township. And it's too bad because I've been working with Marianne and her group since I was warden in 11. So, and they were working on it before I was involved. So it's quite a blow to the community. And there's going to be, there's always impacts by not having the children being taught special safety things that can be done in that setting. So it is sad, but you know, they felt that it was just time to, they've been working on it so long and they were just out of gas. And as well, when COVID came along, there's no fundraising activities they could do and a number of things that she said in her note. So it's too bad.
Yes, we do appreciate their efforts for sure. And it is unfortunate. Okay, any other questions or comments about that correspondence? Seeing none, motion, all in favor of receiving and filing that. That's carried. Thank you. And we'll go to B information reports from court services. And is there any questions, comments on that report? Mr. Pilarcio, would you like to comment on anything in that report?
Through the chair, just it's an information report regarding court services. Some of the most recent information is that courts won't start to reopen. The earliest date is July 6th. One of the positive news is our first quarter, actually, our numbers were relatively on target. But as you know, with the second quarter, we definitely have had a drop in revenue in the second quarter. and we're hoping that, you know, things get better in the third and fourth, but we're monitoring the situation as much as we can, and trying to ramp up as far as resuming operations in July.
I apologize to the staff. I didn't get a motion to receive and file can we bundle those two reports? Or sorry, no, that was just the one. Moved by Councillor Arnold, seconded by Councillor Stark. That's good. Any questions? All in favor of receiving and filing that report? That's carried. Thank you. And we're going on to Social Services Division. There's two information reports here. We'll start with A. We need a motion to receive and file that.
I so move.
Thank you, Councillor Bouchy, and seconded by Councillor Loosely. Any questions or comments on that first report? Councillor Hand.
I just thought it was, when I was reading, that 5 communities were selected. I thought it was significant that this area was chosen as one of the 5.
Mm-hmm.
So I think that's kudos to our group here, that they must have had some impact on getting chosen. So congratulations on that.
I was wondering, yes, thank you. I was wondering, do we have a higher than average homeless rate here in Sarnia-Lambton?
For you, Warden Weaver, to Councillor Romboats, I can't speak to if we have a higher than average number of people experiencing homelessness. I haven't looked at the population to ratio. That actually would be an interesting statistic. I'll see if that's something we can follow up with you. What I do know is that when we put in our application for Reaching Home, although we had a lot of excellent programs that we were funding within the county to help those experiencing homelessness, we didn't have a system in place sort of to take people from entering the homeless system to exiting. So this funding will allow us to put that system in place. It will allow for a coordinated access system and a by name list, and the by name list will capture individuals' names and circumstances and assist us in placing them in permanent housing. And that part was lacking, and it'll tie all of the programs together.
Okay. Any other questions or comments on that? I did notice Timmins was one of the other communities, and I had met one of the counselors. This is just a thought that I had when I was reading this. I had become friends with one of the counselors from Timmins, and she spoke of their homelessness issues, and she said that they started out with kind of a hidden homelessness problem in their community, where it was more people that were couch surfing and things like that. And so they put in place programs to try to prevent that from happening and to help those people. And what ended up happening in Timmins was they became kind of known as a good community for homeless people. And in that, the homeless rate actually went up in their community because people were coming from the bigger centers to Timmins for that reason, because they had all these programs to help homeless people. And I'm wondering if perhaps, and this is maybe a little bit of conspiracy theory, if our communities are chosen as opposed to some of the bigger ones, so that they can have an area that is more homeless friendly. I don't know if anybody else has any thoughts on that.
Just a comment. Some of the communities surrounding us are also Reaching Home designated, City of London, County of Wellington, and they have quite robust homeless programs as well. And I would have to say, actually, the City of London, just because of their size, they have more supports for those with mental health and addictions. So often individuals will migrate to the larger community. So I'm hoping we're not going to do any type of social media to promote people moving to Lambton County. We will probably see an increase in our numbers just because we're actually counting them. So when you start to count something, you sometimes see a slight increase. And like Timmins, we have a lot of people with hidden homelessness. A lot of people were couch surfing. And I have to say through COVID, our numbers have started to slightly increase. And we think it's because people really can't stay couch surfing, right? The people they're living with have lost their income. So they're now being exited to the street. So we're seeing a little bit of that, but hopefully our numbers will flatline and then start to decrease as we house people appropriately. That's the ultimate goal, is that we are able to house the citizens of Lambton County. We also look at where people are coming from. And if people are starting to come here from other communities, we would certainly encourage them to go back to their own communities. People always have more supports in their own community from family, things like that.
That's what she was concerned about, is that they were coming in from other areas and didn't have the family support. So, Councillor Hand.
Valerie, you made a comment today that I thought some people might want to hear, that was interesting, on the Sarnia Control Group call today, about one of the benefits, I hate to say it that way, but of the current pandemic, in actually being able to get names and better statistics on the homeless population. Maybe you could share that with this group.
Sure. Presently, the number that we have experiencing homelessness that we're aware of is just under 100. We have just under 100 individuals staying at the shelters, the Overflow Shelter, and some other hotels that we've placed people. And we're using it as a springboard with the funding from Reaching Home to start that by name list. So we're now gathering information about those individuals. Why are they homeless? What are their barriers? And we've put a county outreach team together with social services, public health. CMHA is going to be assisting us as well to deal with individuals with mental health issues. And we're starting to attempt to move those individuals into their own apartments, into their own homes with all of those supports, because we know that's why they didn't remain housed. So we're trying, like I said, to use COVID, if you will, as a springboard for that by name list, and to try to make it positive and move those individuals from the shelter and from the hotel into their own homes. But the supports are really important, and now we have the dollars for those supports.
Thank you.
That's great. Any other questions or comments on that report? Seeing none, all in favor of carrying or receiving and filing? That's carried. Thank you. And we'll go to B, which is the Social Services Relief Fund report. Any questions or comments on that one? Or sorry, let's get a motion to put it on the floor first, or to receive and file. Moved by Deputy Warden Marriott, seconded by Councillor Cook. Any questions or comments on that one? It was a great report, Valerie. Oh, Councillor Arnold.
Thank you, Madam Chair. I'm just wondering if we keep track of how much per person that this grant will end up being per homeless person, or, the relief fund, how that gets sorted out. And then do we have metrics around that to improve those numbers, to get more money out per person than what the total amount is? Because I know there's a certain amount of admin and all those things that go along with it. But I just want to make sure that the dollars and cents coming through that the majority of that money is going to be in the hands of the people that actually need it. And so just curious as to if we keep track of those metrics.
Through you, Chair, to Councillor Arnold.
Yes, please.
It's a bit of a challenge to keep track individually, and I know what you're saying, just at the cost per person, but you might recall this is the fund that we provided $120,000 to the food bank. So we have to get that information back, as well as we're giving dollars to many of the community agents to be able to provide the services they provide. So while they'll be providing us data on numbers served, it is a challenge to collect the exact apples to apples data from 20 different agencies. A lot of the dollars are also being used for enhanced cleaning, for enhanced staffing at the shelter. So it would really be a challenge on that one. When we're looking at things like the rent energy bank, specifically those dollars that are going out to individuals and families, yes, we will be able to say exactly that 300 families received on average $500 each, or those things we are keeping numbers on. Some of the other ones are more of a challenge. But I can assure you that all of the dollars are going out to families and individuals within the County of Lambton and to support those vulnerable individuals.
That's great. Any other questions or comments on that one? Seeing none, except for a positive thumbs up, all in favor of receiving and filing that. That's carried. Thank you. Now we have in part B, a report requiring a motion. So we have our 5-year housing and homelessness review report. Everybody's had a chance to read that over. And there is a motion at the end there that the County of Lambton and Lambton Housing and Homelessness Plan 2020 to 2024 be approved, and that staff be provided with the authority to implement the recommendations of that plan. Do we have a mover and a seconder to that? Moved by Councillor Broad, seconded by Councillor Stark. Any questions or comments about that? Councillor Arnold.
Thank you very much, Madam Chair. I found the report was done really, really well, and I appreciated the effort that was put into that. But I did have a couple of questions. And the first one was that I was surprised that we didn't have a representative from our First Nations group as part of the core team putting this all together, especially when you look at their 2% of the population, and they said that there was 26% of the issue as far as the homeless issue that we have in the county. And the other thing that I just like to make mention of that, and it's more of a question if we could kind of get an answer at some point, but just the ratio of private versus public housing, because even though it's a non-profit, all the housing that's going to go on and through here for private individuals, they still have to have a return on investment. The County of Lambton doesn't have to have that same type of a concern because it's being funded publicly, of course. And I'm just, it'd be interesting just for my stats, and it might have been in there, I may have missed it, but I'm just wondering if we could at some point, and I don't need it today or now, just to get that ratio of public versus private housing that we have. And also when we talk about the size of facilities and places to live, I know in our municipality, we're over 800 square feet for a standalone house. And I thought it was very good in the report that they were recommending smaller sizes of housing, because most apartments aim for around 600 square feet for a 2 or 1, like a large 1 or a small 2-bedroom apartment. And when you think of all the people that need housing, that 600 square feet would probably